A new vaccination clinic in Quebec's Lower St. Lawrence region, where health officials say variants are fueling transmission in a way this area has never seen before.
The current upward trend that we see in variants will continue unless something additional is done.
Across the province, Quebec's Public Health Research Institute projects variants will become the dominant strains of the virus here within weeks.
The epidemic of variants of concern has been growing, and the measures in terms of how we protect ourselves from transmission were insufficient to stop this progression.
But that projection comes as Quebec loosens some restrictions, allowing up to 250 people in places of worship, sending high school students back to the classroom full-time, and allowing gyms to reopen. Caroline Lambre opened hers with a wary optimism. She and her clients wonder how long she'll be able to stay open.
Are we going to have a third lockdown? Is that third wave coming? Everybody's following the cases every day. So it's more that uncertainty.
The fact of the matter is that this pandemic is not over.
Raymond Tellier says he's worried about the easing of restrictions now and says Quebec could be heading toward a third wave like Ontario.
The only way to escape it is to continue to have strict precaution, and does not seem to be what we're doing just now.
He says vaccinations are another way out, but that takes time to get enough people inoculated. As Quebec's premier got his first dose, he acknowledged the weeks ahead will be critical. But after a year of restrictions, he says Quebecers need some relief.
If we're too strong, too hard, we may lose everybody. So we're trying to balance.
Legault says he'll watch cases and hospitalizations closely and adjust the measures if needed. Alison Northcott, CBC News, Montreal.
Well, let's check in with infectious disease specialist Dr. Zane Chagla. And Dr. Chagla, first of all, what do you make of Ontario and Quebec easing some of their restrictions?
Yeah, I'm mixed. There are some outdoor settings where physical distancing, the good ventilation are appropriate. So things like outdoor congregations, training, outdoor fitness classes can operate pretty safely with minimal transmission. However, easing restrictions on indoor settings, particularly where there's crowds and poor ventilation with variants circulating, you're asking for more transmission. And those settings really need to be examined carefully as part of this plan.
And some of that spread indoors, and I know they say this in British Columbia as well, are social gatherings, but you'd also like to bring attention to workplaces.
Yeah, absolutely. I think we saw essential workplaces seeing the brunt of COVID-19 throughout this pandemic. We've seen variants circulating more and more in these workplaces. And so without necessarily putting interventions in place targeted towards workplaces, even the ones that have to remain open, we're really not going to be solving this problem. And we're going to see transmission into the communities and their households.
All right, Dr. Chagla, thank you.
No problem.